Hey, Dr. Bob here, and in this short video I just wanted to explain some of the benefits of seeing a prenatal chiropractor throughout pregnancy. And so first off, there's a couple of reasons that women will go to a chiropractor throughout their pregnancy. Some women will go in early on in their first trimester, or some women are coming in when they're 38, 39 weeks pregnant. The reason that you would see someone come in during the first trimester, there's usually a couple of reasons. Number one would be pain. So if a woman is starting to experience back pain or hip pain or sciatic nerve pain, which is the pain that goes down the hip, down into the leg on one side, we'll see patients for that reason, because chiropractic is a great way of treating these types of symptoms without medications. There's no surgery or anything like that. The main goal of chiropractic care is to eliminate the root cause or interferences within the body, which allows the body to function and heal properly. And a body that's functioning and healing properly is not going to show very many symptoms. And so chiropractic is great through prenatal care. It's a great option when someone is experiencing pain, and that's usually early on in the first, maybe second trimesters. And a lot of times if that goes untreated, we'll see someone that comes in during the third trimester and the pain is excruciating now. So maybe it's been there for a little while and it's just getting worse and worse and worse. So we treat the same things during the third trimester, they're just typically in a lot more pain. So pain will be the first reason that someone sees a prenatal chiropractor. The second reason would be about, how I explain it is, it's about balance. Because when you see a prenatal chiropractor and they work on aligning your hips and your sacrum and your lumbar spine, it's all about balance. So when you can balance your hips and your spine in the best position possible for you, research shows that it'll create a better outcome, just not from the pregnancy standpoint, but from the labor standpoint also. And so what this looks like would be, for example, if a woman came in and she had massive rotation in her hips and muscles are stretched on one side and another side they're bunched up, it's going to place torsion forces internally. And the way I explain it is, it's almost like taking the inside of your pelvis, and instead of the muscles being nice and relaxed, they're all pulled tight like a rubber band, and it somewhat creates like a maze. And so it's a little more difficult for the baby to move into the proper position. In a lot of cases, it might be a little more of a difficult labor, maybe a little bit longer too. So women will come to us to try to balance things out as best they can, especially women that are trying to birth naturally, because they want this process to go as smooth and fast as possible. So balance is a key component here. And a couple things I will say, kind of playing off of that, the balance aspect of this, we see a lot of women that will come into our office and they'll fill out their forms when they first come in, their new patient paperwork, and they'll ask, why are you here? And they'll say, my baby is in the breech position. And they might be like 34 or 35 weeks pregnant, and they heard that chiropractic care can help flip a baby. And it's kind of the way I explain this is, again, it's about balance, and it's a fine line, because the chiropractors are definitely not flipping babies. That's not what we do at all. But when we work on mom, if you set up a better environment within mom, so if we create balance in her hips and her spine and release torsion forces and muscles, it creates a better environment, and a lot of times the babies do flip. So we don't flip the babies will actually turn on their own. And I think, across the board, when you look at the chiropractors that are trained through the ICPA, which is a prenatal certification process, and the technique that we use is called Webster, I believe they state that there's, with their research studies, there's an 80% success rate having babies turn that see a chiropractor. Again, we're not turning them, the babies turn on their own. We just change the environment. But if you are thinking about seeing a prenatal chiropractor, a good resource is to go on the ICPA's websites. You can click on Find a Chiropractor and you'll be able to see someone that's in your area that's Webster certified. Obviously the technique's a little bit different. If you've been to a chiropractor previously, when you weren't pregnant, it's going to be a little different than what you're used to, because we have to take certain precautions when a woman is pregnant. But I feel like it's one of the best things that you can do for baby positioning, for relieving pain, and making the overall pregnancy a great experience.
Be sure to follow the Mason Method for Natural Childbirth on Facebook, Twitter, and Instagram.